Hi, my name is Zach. I'm going to be your nurse practitioner today.
Hello,
Can you tell me your name?
Jessica.
Jessica. And for the purposes of this video, are you okay with me uploading this to YouTube to be used for grading purposes? And once the grading purposes are done, then it'll be put to a private status.
Yes.
Okay. All right. What brings you into the clinic today?
Just getting my abdomen assessed.
Abdomen assessed? Okay. Just a couple questions. Can you tell me your name and date of birth?
Jessica Alberts, August 23rd, 1994.
Okay. And do you have any race or ethnic issues or religious backgrounds you'd like me to follow today?
No, no preferences.
No preferences? Okay. And what do you do for work, Jessica?
I'm a postpartum nurse.
Postpartum nurse. Okay. And just a few more questions. Can you tell me any past medical problems that you have?
I don't have any.
No past medical problems? Okay. Any surgeries in the abdominal area?
No.
Okay. Have you gotten all your immunizations?
Yes.
Any allergies that I should be aware about?
No.
Are you currently on any medications?
No.
Do you have any family medical history?
No history.
Do you drink alcohol?
Nope.
Do drugs?
Nope.
Smoke?
Nope.
Okay. Do you follow a regular kind of diet?
Yeah, my diet's pretty balanced.
Pretty balanced? Okay. Do you have any recent fevers, chills, or fatigue?
No.
Any problems with your eyes? Any changes in vision?
No.
Any problems with your ears,
No.
nose?
Nope.
How about swallowing?
Yeah, that's fine.
You're fine? Okay. Have you noticed any swelling in your hands or your feet?
No.
Any problems with your heart?
Nope.
Any troubles breathing?
Nope.
Have you had regular bowel movements?
Yeah,
How-
every day, once a day.
Every day, once a day? Okay. No burning while you're going pee?
No.
Okay. Any muscle pain?
Nope.
Okay. Any issues with your skin anywhere? Any lumps, lesions?
No.
And have you noticed any lumps or lesions on your breasts or tenderness?
No.
No? Okay. So for part of the abdominal assessment today, we're going to be doing four different types of an assessment. It's going to be inspection. Then I'm going to do an auscultation, which I'll use my stethoscope. Then I'm going to percuss, which means I'm just going to tap with my fingers on your abdominal area and spaces. And then I'm going to be pressing as well, too.
Okay.
So for the first part, I'm going to have you lay back and we're just going to take a look. I'm going to have you pull your shirt up. Okay, that's perfect. So I'm inspecting the abdomen. Abdomen looks symmetrical. I don't see any lumps. Color is even through and without the total sides of the abdomen. Let's see. Okay, so now we're going to take a listen. Have you noticed any lumps?
No.
Okay, so I'm just going to take a listen to this sounds. Right? And listen in the lower right quadrant. Okay, and I'm hearing vowel sounds. In the upper right quadrant. I'm also hearing vowel sounds. Left upper quadrant. Also hearing vowel sounds. Lower quadrant. On the left. I'm also hearing vowel sounds. And I'm coming over here by your liver, and I'm just listening near the liver for any friction rubs, roots, or bruise. Okay. That sounds normal. I'm coming over here, feeling for the bottom of the rib, going up one, and what I'm doing is listening to the spleen. And that all sounds normal. Now I'm going to take a listen with the opposite side of the stethoscope, the bell. Same thing, listening over the liver. Okay, we're coming back over here to the spleen. Going up. I'm going back towards midline to listen for the aorta for any broods or thrills. I'll listen with the other side of the stethoscope. And that all sounds normal. Now I'm going to be using the diaphragm of the stethoscope to listen for the iliac artery. Pressing down right here, just off the hip. And going to the other side. Same thing for the iliac. And then I'm moving down towards the leg, to the femoral artery. Moving over to the other side, to the femoral. That sounds normal. All right. And now I'm going to percuss, which means I'm going to put my finger on your stomach and tap.
Okay.
We're going to do it on all sides. In the abdomen area, we're looking for a tympanic sound. Once I get up to the liver, I should be listening for more of a dull sound. So, first time, right? All right. And that's all a tympanic sound. Now I'm going to go over to the edge, and what I'm looking for is the edges of the liver. Here we go, right? And that's dull. And I'm going to also percuss the spleen, looking for the bottom of the rib and moving up and going, trying to get around the edge of the rib. Okay. All right, so now we're going to go with palpation. So I'm going to start with a light palpation. And what this is going to help you do is start feeling more comfortable with my hands being on your stomach. If you do feel any sharp pain of any kind, let me know.
Okay.
Okay. So starting in the lower right quadrant. I don't feel any lumps, bumps. And this is the area in the lower right where I would feel for appendicitis. Now I'm in the upper right. I'm not feeling any bumps, and there's no pain. Over to the left, upper quadrant. Any pain?
No.
Okay. Any tenderness of any kind?
No.
Okay. And down to the lower left quadrant. Just a light palpation. Okay. All right. And now we're going to go to deep palpation. I'm going to press down a little bit further and deeper.
Okay.
Let me know, same thing again, if you start to feel any tenderness or pain and feel any weird feelings. Okay.
Okay.
All right. So we're going to go a little bit deeper. And I'm not feeling any lumps, no reports of pain. Feeling to see if there's possibility of appendicitis. Now moving up higher. You can't go too high because if not, you run into the edges of the liver. I'm feeling section of the colon, transverse, and moving over to the left side, upper. Deep palpation. Same thing again, feeling a section of the colon there, the bowel, and moving down. Any pain there?
No.
Okay. And all feels within normal limits. Okay. So now what I'm going to do is move over here to the hip. I'm pressing down right here. And this is the ASIS. Which you measure from the hip bone across to that belly button. And when you're pressing down and letting up, Patients sometimes will report pain there. I believe it's called Micah Burns point. What I'm gonna have you do is press up with your thigh onto my hand while laying flat like that. Press, press, press. Okay. And again on this side, press, press, press. Any pain?
No.
No pain. Okay. Next thing we're going to do is check for any ascites inside of your abdomen. Ascites is just basically a buildup of fluid. So what I'm going to have you do is put your hand in the midline of your stomach, straight down like that. Perfect. And what I'm going to do is tap one side of your abdomen, and then I'll tap the other side. What I'm looking for is any waveform of fluid shifting across from one side to the other. Okay, ready? One more. Okay. That's it. We're all done. Okay. And you can put your shirt down. All right, Jessica, do you have any questions of any kind?
No.
Okay, everything looked good today. Everything is within a normal limit. It's right where it needs to be. I'm not feeling anything abnormal. Good job.
Okay, thank you.